Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right 4 and 6, the upper left 4 and 6, and the lower left 6. Now we'll start with the upper left segment. The upper left segment, this is the transaxial view, which is basically the proximal view. Here you can see we've got the BDRs of the upper right 4, which is endodontically treated and grossly carious. The measurements in this segment from the crest is 7.2 millimeters, but only 8 millimeters of ridge height because it's very thin at the apical portion. So implant placement immediately is not possible. They definitely will need to be grafting and bone augmentation. The upper left 6 region has D4 quality bone, D3 to D4, and we've got 6 millimeters of ridge width and only 6 millimeters of height. So a short and fat implant will need to be placed, but here also bone augmentation or sinus lift will be needed. The lower left segment here you can see very clearly also has very thin ridge. We've got approximately just 3.6 millimeters of ridge width with approximately 13 millimeters of height. Here also for a molar region, we've got absolutely thin bone, even though the bone quality is D2 to D3, but we have very little bone for implant placement. Now moving to the upper right segment, this is where the upper right 4 is. Immediate extraction followed by grafting is going to be a good idea. We've got 8 millimeters of ridge width and approximately 10 millimeters of height. So here if grafted, implant placement will definitely be possible in the future. Immediate implant placement is not possible. We also have a very apical radiolucency. Moving to the region of the upper right 6, we've got approximately 6 millimeters of ridge width but only 3 millimeters of height. So here again, a lateral window sinus lift procedure is definitely advised. Thank you very much.